Confidentiality is one of the topics for your professional value station during your NMC OSCE. What about it? A scenario could be painted like this, that a partner, which is your patient, could be female or male, is having a condition, disease condition. Probably it could be terminal illness or anything, but it doesn't want it disclosed to his or her partner. How will you address this? What are the points that is expected of you to write for this station? Number one, it is your professional duty to provide reassurance to the patient. But while you are doing this, you need to respect patient's right to privacy and confidentiality at all times. But this must be done with honesty and integrity at all times, reflecting the duty of candor. The second point you should write is, since the partner does not want this disease condition to be disclosed to the partner, you need to explore why. Ask the reason for withholding the information from the partner. The next point you should write is, you need to offer support and time to facilitate discussion between these two partners. However, it is important to put into consideration the patient's wishes regarding this, reflecting the duty of candor. The next point you should write is, you need to document the patient's wishes regarding information sharing and the disclosure of our diagnosis. The next point you should write is, for this partner's curiosity, you cannot leave it unnoticed. You need to acknowledge the partner's concern and feelings as he is acting with care and compassion, but you need to still explain to the partner that you need to respect
your patient
wishes, also our right to privacy and confidentiality in all aspects of the care you render to him or her. Finally, on that note, you need to acknowledge the need to keep to and uphold the standard and values set out in the code. That is, to prioritize people, practice effectively, preserve safety, and promote professionalism and trust. I hope you've learned something. These are the points you should write under this confidentiality if it comes for you in your professional value in your NMC OSCE. It's as simple as that. Until I come your way in my subsequent videos, keep practicing OSCE. Bye.